Okay, in this video I'm going to talk about sinus lift. Okay, sinus lift is actually, there's several different types of sinus lift graftings. Okay, the most traditional way of doing a sinus lift grafting is where you make a little hole in the sinus wall, which is kind of right over here in the first molar, premolar area, and you actually remove that wall off, and underneath that wall is going to be a membrane. And that membrane is delicately lifted up so that now the membrane is off of the sinus wall. And into that area we place bone grafting. And the bone grafting is usually something like bio-os or some sort of xenograft material. And then we go ahead and close the gums and we let it heal for about 6 to 9 months. And then we should have enough bone for placement of dental implants. That's why sinus grafting is traditionally done. Now, I do that type of sinus grafting when there's very little bone for me to place a dental implant. Maybe 1 to 2 to 3 millimeters of bone. So not much bone for me to place an implant. That's where we would do the traditional sinus lift. It's also called a Caldwell look approach to a sinus graft or a sinus lift. Now, a sinus graft and a sinus lift are pretty much the same thing. The sinus lift just refers to lifting of that membrane, and the sinus graft means placing a graft material inside of the sinus. Now, more and more we are shifting now to what are called internal sinus lifts or mini sinus lifts. Now, these are very, very different in that we don't have to make a big hole in the sinus and lift up the whole membrane from the side. We actually can lift up that sinus membrane from the same hole that we're making for the dental implant. So I do some drilling in the bone right below that sinus, and then we use either specialized drills or even a little osteotome to go ahead and lift up that membrane from the inside of that implant hole. So it's a much less traumatic type of procedure for the patient. They have much less swelling, the pain is significantly less, and now we're able to put the graft material exactly where we need it for the dental implant. Now, you can't always do an internal sinus lift. If you only have 1 millimeter of bone, then doing an internal sinus lift is very difficult, and it's something that I typically don't do. If I've got about 5 millimeters of bone below that sinus, then that's where I would probably do an internal sinus lift and place a dental implant at the same time. So that's the difference between an internal or a mini sinus lift versus a traditional or Caldwell look approach to a sinus lift or a sinus graft.